Sam Seder on the Majority Report. Emma Vigeland out today. It's a pleasure to welcome back to the program Jonathan Cohn, senior national correspondent, now at the Bulwark, author of Sick and the 10-Year War. That one about, about the Affordable Care Act. It seems like a million years ago. Jonathan, welcome back to the program.
It's nice to be here, Sam.
Over the past week, we have seen the agency director of the CDC sort of get fired and then resign, and then 4 of top officials at the CDC also resign. I think today, 1,000 workers at the CDC wrote a letter imploring the administration fire Robert Kennedy Jr. Let's talk about, one of the things that came out over the past week was that over the course of the past 9 months, approximately, that Kennedy has been head of Health and Human Services, he's never consulted with the CDC about anything.
Yeah.
It's insane.
It is. I think before, I think actually a good place to start, just as a general description of what is happening right now at the CDC, and frankly, not just the CDC, other agencies, but CDC, which is such an important, it's our command and control center for protecting our health. The way it's being treated, the way it is not being treated, the extent to which Robert F. Kennedy Jr., the most important health official in our country, has basically not consulting career staff, the experts there, on such a wide variety of issues is shocking. And the chaos we're now seeing there between the layoffs and the reorganization and the resignations and the firings, shocking. I mean, this is another universe from anything we've seen before. I mean, I've been doing this for a while. I'm a little gray in the beard here. I've covered Republican presidencies. I've covered Democratic presidencies. I covered the first Trump presidency. Nothing like this. This is completely dysfunctional government. And we have, I almost feels like a rogue HHS secretary running around making policy because he thinks it's right, surrounding himself with yes people who will go along with it. And everybody with expertise, everybody who has background in this, left and right. And, when we're talking about the civil service, most of these people are not political. They're just career civil servants trying to serve their country and keep it healthy, being shut out of the process.
I was so shocked about this. And I will say that, full disclosure, and people know this, I hope, but I had worked with Kennedy on a radio program 10 years ago.
Right. That's right. I forgot about that.
There are people who are more disillusioned about him than but I know those people. So I'm in that, some of that universe. And it is one thing to say that he has these conspiracy theories in his head and preconceived notions of who's at the CDC and what their secret nefarious agendas are. But the idea that he didn't even bother to go and spend half an hour over the course of 9 months, an hour, even a couple of days, to make that assessment in person, just completely ignore this entire agency as if it doesn't exist, is mind-boggling. And this is an agency that is the product of over 100 years of essentially U.S. health policy.
Yeah, again, I've never seen anything like this. And, he has come in and he has this idea that the CDC is part of this deep state health bureaucracy, which of course is, it's similar and of a piece of the broader attitudes of the Trump administration, that people who are career officers in government they're at best not doing a lot of good, at worst they're actively undermining whatever the sort of best policy is. And his attitude has been to just sideline them and ignore them and get rid of them. And look, I've said from day one, I mean, I think there's every agency in government could work better. And if you want to talk about the CDC in particular, we can go back and relitigate what happened in COVID. And there's lots of room for criticism, lots of room for improvement. I don't think anybody would begrudge an HHS secretary from either party coming in and trying to shake things up a little bit. And certainly when you win an election and you get to, that's part of what you get to do, is you get to redefine an agency. But what I think is just so telling is there's a way you do that responsibly, right? I mean, and the first part of that is exactly like you just said, which is you get a feel for what's really going on, something you can't get from the outside. You get into office, meet with people, you study the problem, and then you put in place changes. Even if they're radical changes, you do it in a way so that you're not destroying all the institutional knowledge, all the capabilities. And that's what he has done. And we are at this shocking place right now. I know we keep using the word shocking, but it's I don't know what other word to use for it, where you can't trust the material coming out of CDC, because once upon a time you knew that it might be right or it might be wrong, like any judgment might be, but it was the process of a kind of considered judgment by people who actually knew their field, who were respected for their knowledge, their expertise. And that's just not true anymore. And it's just we've never been in a world like this.
And we're talking about career people, which is contrary to, Kennedy's whole thing was that there's a revolving door and there's this relationship between industry and the agencies that are unhealthy. And I would agree with that. I think we see that in a lot of sort of regulatory agencies. But it's generally the political appointees who are the biggest problem, or people who are leaving, not people who have been there for their entire careers and are continuing to do that. And so, all right, so who's doing what the CDC does? I mean, it seems like they're not allowed to sort of keep track of what's going on. They weren't consulted about the measles outbreak that was taking place. They could still be apparently in Texas, it is sort of burnt out, but we don't know what's happening in contiguous states. We don't know, because none of this stuff is now being, to the extent that it's being recorded by the CDC, they're not allowed to publicly report it, is my understanding. What else has he supplanted? And then I want to get to the vaccine, specifically in terms of vaccines, but what other functions are superseding, I guess, the CDC at this point?
So, I mean, it's hard to know, which is crazy to say. I mean, this is not how government normally works. We usually have some sense of how an agency works. We might not know at the detailed level of who's doing what, but there are offices and this is what they're doing. It's quite hard to know right now. This is not, this administration, again, not just HHS, not just CDC, the entire Trump administration. They don't put out memos saying this is they don't put out the reorganizational memos. They don't tell you what they're doing. What I know, first of all, is that we have a bunch of departments that have been eliminated or downsized dramatically. And that is as a result of that, even the parts of CDC that are kind of, you would think, on autopilot. So these are the things that maybe Kennedy doesn't care as much about, like, helping cities and states with lead abatement, for example. These offices are so understaffed now, they can't respond quickly. And that's one of the most important roles that CDC plays, is as an advisor and kind of a big sibling to state public health agencies. State public health agencies, they're the ones on the ground frequently dealing with outbreaks when they first happen, or environmental toxins. You sort of go down the list, and they need expertise. They need manpower. Sometimes they need someone to just pick up the phone and sort of call on behalf of the federal government to make the wheels of bureaucracy or the private sector respond. And CDC, that's a really important role of CDC. Well, you can't get any of that done if there aren't people to pick up the phone or answer the emails. And that's what's happening at CDC right now, because they've been so decimated that they are just not responding. We saw this actually in the measles crisis early on. There was a story one of those stories that I thought would have gotten more attention. It was in, I want to say KFF Health News, about how the people in Texas during the outbreak were saying it was really hard to get responses out of CDC when they needed help, when they needed expertise, when they needed advice, when they needed the federal government to kind of be the heavy and make something happen. They just weren't getting calls back. And it seems like it was a combination of A, there weren't enough people because they've been downsized so much, and B, there was this hesitation because it touched on measles, because it touched on vaccines, because there were these orders telling CDC people not to communicate certain things in public. There was hesitation. What can we do? What can we not do? What will be allowed? And it's just mind-boggling. I mean, this isn't this shouldn't be a left-right issue. It shouldn't be a Democratic Republican issue. It's public health. It's keeping people from getting sick and dying. I mean, there's nothing political about that.
Well, I want to turn to the story you did about the vaccine industry about a week or so ago, because it seems to me that Kennedy has taken a very libertarian turn over the past 10 years. And just the concept of public health is, he has an issue with the concept of public health, it feels like. I mean, broadly speaking, will you just sort of, I guess, walk us through that notion of what public health is relative to when I go see the doctor, right? Because there's a different sort of calculus that's going on with public health than there is with an individual's health.
Yeah. So, I mean, when I think of public health, there's a lot of different ways to describe it. But, when I think of public health, I think of threats that are out there, that are threats to whole communities or threats to the country as a whole, to the public as a whole, where we can address them best through policies. They may be policies that get at the underlying causes of disease or conditions or biological threats. We can be working together on being vigilant, watching, detecting them, so we know when something is happening in the aggregate. And then, of course, if something happens, if there's an outbreak, if there's a condition we see happening at a large scale, affecting large numbers of people, then we can start to respond. And it obviously requires medical knowledge. That's an important piece of that. What your doctor has, right? That's part of it. But there's a whole other kind of knowledge, a whole other skill set that is specifically involved in understanding how to watch, monitor, react to these sort of healthcare threats at a larger scale. And that is what CDC does and always has done. And what the people at CDC do, they're trained to do. That's a special kind of training you get. It's a special kind of experience you accumulate. And frankly, that's what's going out the door right now.
And there's also, like, it seems to be a different sort of a calculus, right? Like, I mean, we have this in public policy all the time. What should the speed limit be? We could bring traffic deaths down to, virtually none if our speed limit for all our cars was 5 miles an hour. But obviously society needs to function. People need to get places, and we find some type of balance between the need for us to have transportation for food and for products and for individuals, and the potential that, tens of thousands of people are going to die on the highways because of the speed that people travel. There's a similar calculation in the context of public health, right? Like, we can say that it is inefficient to have free colonoscopies at for everybody who's age 30. But at one age, it does start to make sense that, yes, it's going to cost money up front to have everybody get colonoscopies, but it's going to save money down the road. I mean, these are all the calculations. There are going to be some people who are still, had they gotten that colonoscopy at age 30, because it was mandated, would have saved their lives. But it's, as a society, we make the determination that we can't function as a society saving that. This calculus is what really is at the heart of the vaccination issues, it seems to me, is that when we vaccinate a broad population, there are always going to people who are going to have adverse reactions, just like people who take Tylenol. Like there's no medical procedure or medicine where you won't have people taking an adverse reaction. But the question is, as a public, does it promote health, i.e. more people being healthy than not, even if the actual requirement of a vaccination ends up making people sick who wouldn't otherwise be sick?
Yeah,
right. I mean, this is the dynamic that we're talking about with vaccines.
Sure.
And so tell us the story of how we got to where we are, like where we are in terms of liability with vaccines and why. And we should talk about potential reforms. But Kenny's talking about basically blowing it all up, it seems like.
Right. So, I mean, yes, vaccines, the vaccines that we have that have been approved, they're enormously beneficial. They have saved literally millions of lives. I think sometimes it's been so long since we've seen people sitting in an iron lung or large numbers of kids dying from measles or whooping cough, you sort of go down the list. We sort of take those things for granted. Those diseases used to kill and disable large numbers of Americans. It was hard to get a childhood once upon a time. When those vaccines came along, people were elated because they remembered how awful that was. Now, like you said, every vaccine is going to have some people who are going to have side effects or bad reactions, just like every medical, as you said, every medical intervention has some risk and some downsides. Decision you're always making is, when is it worth it? When is it not? What do we recommend? What do we not recommend? And with these vaccines, the calculus, frankly, is just not tough. Even a vaccine like, say, the COVID vaccine, which doesn't, at this point, because of the way the virus has mutated and what we now know about it, is, there's still a good chance that if you are vaccinated against COVID, you can still get COVID. But there's a big difference. You're much less likely to end up in the hospital. You're much less likely to end up with long COVID. You're much less likely to end up dead. That's a pretty big deal. Now, do some people have reactions to COVID, this COVID shot? Yes. Will there be the rare serious side effect? Yes. And true for other vaccines. This has always been the case. And we've sort of dealt with this problem before. In the 1970s and 1980s, there was a lot more focus on these side effects. And in particular for the pertussis vaccine, again, that's whooping cough, there was a lot of attention being given to the side effects, including the ones that would go away in a day or two or in some time. And then there were reports of more serious side effects. Never entirely clear how much they were really linked to the shot. Later research suggested maybe, probably not. But there were these cases, and people who had sort of serious conditions after getting the shot would go to court and sue and get these very large liability judgments. And the vaccine makers at that point were like, well, wait a minute, vaccines aren't necessarily the most profitable line of business for a drug company. And the drug companies were like, if we're going to have to face these lawsuits and this is draining our revenue, maybe we just won't make the vaccines. And a bunch of them got out of the business of making the pertussis vaccine. When that happened, we had shortages of pertussis vaccines. There weren't enough shots to go around because there weren't enough companies producing them. So the government stepped in a bipartisan measure and said, look, we're going to, and they said, look, we want to compensate people. If you're injured, we want to make sure you can get compensation for it. We want to make it quick. You shouldn't have to go through years and years of litigation. You shouldn't have to roll the dice on whether you found a good lawyer or not. If you're the vaccine maker, you should know that we understand there will be the very occasional rare side effect. You're not going to be sort of facing this huge, massive judgment because those tend to be sympathetic cases. And even if you did nothing wrong, you're going to have to pay this big judgment. So we're going to protect you from that. And doing this will then produce a steady supply of vaccines, which is what all the pediatricians want, what the public health experts want. So they created basically a no-fault system where you basically, if you have gotten a vaccine and then you have a certain, that's covered by this program, and you have a certain kind of injury you can demonstrate that happened afterwards, you get a payment. And You don't have to go to court and whatever. You can still
It's like
sue for negligence, but it's
and-
hard to win that case. Yeah.
And this is sort of almost like a separate vaccine judiciary, essentially, right? Where
Yeah.
it's more like an administrative judge, and you go and you make your case through this process. It is not within the standard civil legal system. It's almost like in a parallel legal system where you go in and you can get awards, but it doesn't function in the same way, and you can't take down a manufacturer. And again, like you say, it's really the only way, unless, and frankly, I would certainly be open to this. We started having the government create a capacity to develop vaccines. Now, that's what Bobby Kennedy would do if his belief, his supposed sort of conspiracy theories were accurate, that it's too corrupt within the context of capitalism to allow for vaccines, that all the motivations are a function of money. You would say, let's nationalize it. Let's expend government money and resources on developing it. We already spend the money on developing it, and we have ownership of it. And you can contract out to facilities and companies that have the capacity to make this stuff. You hire them, you pay them a lot of money, and it's government owned. They're not even contemplating anything like that. And so, what has happened to that regime over the years? That came in what, like the 80s, early 80s, or
yeah, it was created in the 80s. It was created in the 1980s, and over the years, on the one hand, it has kept a steady vaccine supply, so it's met that goal, and it's kept a fairly, it's kept the vaccine makers in the market, so it's met that goal. It has not always done a great job of compensating people. There's a couple of reasons for that. It hasn't really been updated legally since Congress passed it, so the awards are not as big as they should be. In addition, it's been slow. At some point, the Justice Department decided that it should be contesting these cases more because it saw, it sort of saw its job to protect the federal treasury, and it didn't want to make sure people weren't going to the system and draining it unfairly to kind of make a quick buck. That is not how the program was intended to work exactly. If you talk to the people who were there, and there's been a concern they've pushed back too much so that it is actually harder to get an award. And then in addition, they just haven't increased the staff enough to deal with the load as we've added more shots and more conditions. Fixing all of those makes a lot of sense. It is a cause that would get bipartisan support. If Secretary Kennedy came in and said, look, I want to fix the vaccine court. I want the court system. It's not really called a vaccine court, but, we can call it a vaccine court. If we're going to fix this system so it's more responsive and it pays out sums that are more appropriate for today, I think there would be people, longtime vaccine enthusiasts who would say, yes, that's great. In fact, it's closer to what the program was supposed to be when it was founded. But that does not seem to be, I think it's fair to suspect that it is not what he has in mind. I say suspect because, as with so many other things he's done, he hasn't been particularly clear. But he has hinted strongly, and people I know who have heard about some of these discussions and all the scuttlebutt that's being reported is that he is looking more at changes that would really just blow up the system. And we sort of revert back to the pre-1980 system, at least for some of the vaccines. Or that he would create a system where it would run out of money very quickly. But one way or another, the guarantee to the companies that they could continue to produce without facing these huge liability threats that had once scared so many off, we'd be back to that system, and we'd be back to shortages again. And that is the concern, and I think there's good reason to be concerned.
What's that? We should say that just, I guess, an hour ago, Florida essentially said that the state's going to eliminate all vaccine mandates.
Yeah, I saw that.
And
like 10 minutes ago. Yeah.
Yes. And earlier today, I think it was California, Oregon, and Washington State said they're going to form some type of consortium to, I guess, secure vaccines or create their own guidance because they're not getting any from the federal government in terms of like who is advised to get the COVID shot, and then I guess presumably any sort of future viruses, or maybe even the flu for that matter. What do we do if, like, I mean, I want a vaccine booster. I'm not 65 yet, a couple of years shy, but I want my vaccine booster. I want my COVID booster. I don't want to get COVID. I want my kid to be able to get a vaccine booster as well, because I've seen the impact of long COVID, and I've seen the impact on kids subsequent from getting COVID. The first time they get it, it's not a big deal. What do we do? Like, do I got to go to Canada? And is there going to be like vaccine tourism trips to like Canada? Or
I mean, it's it's hard to know. First of all, a lot is going to depend on things like what insurance companies decide to do, what they decide to cover for people who have private insurance. Obviously, for people who are on public insurance programs, that's going to depend on what the government says. It is not clear to me to what extent states will be able to manage vaccines within their borders as they want. I mean, there's so many layers of legal complication to that. But let's assume, for the sake of argument, that we end up with a system where, okay, the California, Oregon, Washington, they make sure that vaccines are available and they keep in place their vaccine regimes, and maybe New England does.
California is important, right? Because we're just talking like this is a numbers game. Like at one point, a manufacturer will be like, it's just not worth our while to produce this small amount of vaccines. I mean, there was a Lyme. Apparently, there was a Lyme vaccine, I don't know, developed 20 years ago, and they just decided like there's just not enough of a market for it, and so we're just not going to produce it. And now Lyme has gone completely bonkers up in the Northeast.
So I mean, let's assume for the sake of argument, and you're right, having California, having New York, those are big markets, so that presumably keeps. Let's assume optimistically for the moment that there's enough states that are sort of really still on board with vaccines, that the makers still stay in there, and so New England, the Northeast, West Coast, maybe my home state of Michigan, places like that, we still have vaccines, and most people are vaccinated. And let's then assume that there are states where you see vaccine levels dipping, like we did in that part of Texas, like we might see in Florida. On the one hand, I mean, this is now the fact of life in so many things, right? With our social programs, we have Blue America, Red America, and they're very different. Problem is, germs don't stop at the border, right? So number one, that's only going to do so much good. But I also was thinking, just to give you an example, and when I think of sort of like who is vulnerable, I think there's a tendency to be a sort of libertarian, you were saying before, libertarian attitude. It's my decision whether or not to have a vaccine, and at some level, of course, it is. But it's not like that can't affect other people. So I'm just imagining I grew up in Florida. What's in Florida? Disney World's in Florida. Who likes to go to Florida, Disney World in Florida? Kids. How many kids want to go to Disney? Well, if you're an immunocompromised child, if you're getting cancer treatment, for example, and we have a world where Florida vaccination levels are, you better stay away from Disney World. Right. You better stay away from the state of Florida, because just going to that state is going to expose you, increase your exposure to something you cannot fight off. And by the way, again, even if you don't go to Florida, you're still going to be at greater risk, because, again, germs don't observe state borders, and there will inevitably be times, in airports and moving around where you'll get exposed to these things. So these things, that's kind of the world we might be headed to.
It's a little bit terrifying. And I would say, coming out of COVID, it's become very apparent to me that the tolerance this country has for hundreds of thousands of people dying, we've been talking probably since the Iraq War era. We certainly know that there's a tolerance for us to be involved in the killing of people thousands of miles away. But it was a little bit surprising to see the level of tolerance that Americans have for several hundreds of thousands of people to die you know, that were easily preventable over the course of a year or two. I mean, it feels like there's I don't know what that's called. Is it nihilism? I mean, or what? But like, I feel like it's going to take a generation or two of this type of regime for people to respond to it, because it's very hard. It's just so, it's not transparent. It's very difficult, I feel like, for people to see the implications of this when they're looking at a ground level. And when you have removed the aggregation function of the CDC that looks at this stuff and says, hey, look, there's 500,000 people who have died over the past 17 months who didn't need to die. When you don't have that, even that function, it feels like people are just going to go about their business and be like, oh, poor old Joe, he got whatever, the bug, and died.
Yeah, I'm so glad you mentioned that. Yeah, I mean, you remember COVID when there was at one point, right? Trump said, people may remember, he said, well, if we just stopped counting, people wouldn't, it wouldn't be so bad if we just stopped counting the people.
I mean, he was sort of right, at least in terms of the way that the people perceived it.
To this day, I'm shocked because, again, I live in Michigan, so I'm right outside Detroit, which was one of the early cities hit. It wasn't as bad as New York, but it was pretty bad. And I remember every day in the headlines, prominent people you were reading about were dying from COVID. And then, of course, for everyone you read in the headlines because they were famous, there were 10, 50, 100 also dying. They just, they didn't get a story in the newspaper because of that. And I am shocked still that that has sort of been memory hold. And I wonder sometimes, I guess, as you do, is it that people have forgotten, or they've just sort of decided it's okay that, we're going to live with that that it's okay if large numbers of people die. And this does bring us back to Kennedy, because, when you listen to him talk, he's very big on this idea of often called natural immunity, that like, well, one of the problems with vaccines is that, it doesn't provide you with the same kind of protection. If you actually get the infection, you'll have longer lasting protection. It might even protect you against some other conditions. Now, number one, that is not a scientifically valid statement. There's, whether you get more protection or longer protection from a disease versus a shot will depend on all kinds of circumstances, including the disease, the shot, who you are. This idea that it sort of protects you better in the future against other conditions is like this speculative theory. There's really nothing out there yet to show that. But, let's even assume it were true that there was some marginal advantage to getting in terms of your future immunity, that you had better immunity, stronger immunity going forward from an infection rather than the shot. Well, the flip side of that is you're also a heck of a lot more likely to die from the infection, because you got to get the infection. What doesn't kill you will make you stronger, sure, but it might kill you.
First of all, not always. What doesn't kill you does not always make you stronger. But even if it did, it also could kill you.
Right.
Is what you're saying. Yes.
Yeah.
I mean,
I think it's if anything, there's a little bit. I'm not the first to say this, and I don't see inside the man's head, so I don't know what he's really thinking. But people have said this feels awfully Darwinist. The strong will survive, and we'll lose a couple along the way. Or eugenicist, like this is how we get to a stronger humanity, because the people with strong immune systems will evolve. And the reality is. The reality is, because we've had all these advances in medical science, including right at the top of the list, vaccination, lots of people are alive today who would otherwise be dead. And they are people who have, weakened immune systems, or who have some kind of disability, or have some kind of underlying medical condition. These are the people who are saved by vaccines and all these medical interventions. I think that's great. I'm really glad all those people are here. You get the feeling listening to Kennedy that, I'm not saying he wishes they were gone, but the way he talks sometimes, it does sound a little bit like, well, if we lose a few people along the way, everyone's going to, in order, so we just let these infections burn through these communities. If we lose 1 or 2 kids here and there and a couple people die
Trimming the fat.
we'll be better off. Yeah. Yeah.
I mean, it's reminiscent of both what like Ron Paul said, I think it was during the 2008 Republican debate about somebody who doesn't have health insurance, that they die on the street. They've made their own choices. This has a more sort of biological foundation for it. And, like I have spent probably an inordinate amount of time trying to figure out what has gone into at least. There has been, it's not a radical transformation in terms of Kennedy, because he's always flirted with this, with the anti-vax stuff. And to be fair, in 2003, 2004, there was enough of a question about thimerosal that it was removed from the vaccines. And then it turned out, no, this doesn't impact autism rates or anything. And, but I do think that part of it is he comes from essentially, aside from all the sort of like maybe psychological things that are involved in his childhood and growing up. I mean, there's a certain amount of trauma associated with that. There's also like an aristocratic air about the Kennedys. And you see it in the context of how many of them died doing things that they probably shouldn't have been doing. You don't fly an airplane at night if you don't have enough hours of training. You don't go glading through ski resorts if you're not that good of a skier. I mean, a lot of people in their family have died doing things. There were times where I was waiting on Kennedy to record something remotely, and it's he was diving to disentangle a sea turtle from a net, or he's picking up a roadkill, or a bear or whatever it is. I think there's a sense of like, survival of the fittest, and sometimes it doesn't work out, and that's being imposed on the entire society, and it's also ignoring that certain people get born into circumstances, not just that are biological, but are also environmental, that impact their health, that the whole point of a society is to protect them. And it seems like we're going to take a break from that theory for God knows how long. Jonathan Cohn, always a pleasure. Thanks so much for your time today. Really appreciate it.
Yeah, thanks for having me on. Important topic.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.